Hi, I'm Dr. Raj Sinha. I'm an orthopedic surgeon specializing in hip and knee replacement, practicing here in Palm Desert, California at Star Orthopedics. I've been in practice for 22 years, the last 16 here in the desert. I've had the good fortune of being involved in designing implants for several different companies. And I want to tell you a little bit about how we got to a custom knee replacement. So that led us to a whole area of investigation and research, basically saying, well, what is it that causes people to be happy but wish they were happier? And it basically boils down to two things. There's residual pain and there's residual stiffness in some percentage of people. And there's been a lot of research done on this, and it suggests that there's about 15 to 20% of people have this residual pain and stiffness. They're happy, but they wish they were happier. Why does that occur? It occurs for, I think, two or three reasons. One reason is patient issues. If you're very elderly, if you've waited really long to have the operation and your muscles have become debilitated, no matter how well the operation was done and no matter how much you do physical therapy, you've just those people have sort of passed that point of no return, and they just never get the same recovery that they could have had they had the operation 3, 5, or 7 years earlier. And we actually have data on that. It comes from our colleagues in Canada and England, where people are put on these long waiting lists. Some people in those countries have the financial resources to go off the waiting list and get their operation done sooner, whereas other people wait 18 to 36 months to get their operation. And so science has been performed, research has been done to compare those two groups of people, and inevitably the people who were able to get off the list sooner and get their operation sooner do better. They're happier. So that's one thing that causes residual pain and stiffness. The other thing has to do with the implant and the surgical technique. If I do a bad operation, it doesn't matter how well you are in terms of doing your physical therapy. There's only so far you can get. Likewise, if I do a perfect operation, but you just don't do any of the physical therapy, there's only so far that you're going to get. And so a whole group of patients fall into that category, where either the operation wasn't done perfectly or they weren't diligent in doing their physical therapy, and so they wind up with residual pain and stiffness. And the third category has to do with the implant itself. The original implants were designed based upon manufacturing techniques of the 70s, which meant that they had to be somewhat bulky and somewhat blocky. Well, the knee joint is not square, it's not rectangular. It's a very unique mechanism that moves in all directions. And so if you're going to try to match anatomy to give people the feel of a knee like their normal knee was once upon a time, then you have to have better manufacturing techniques so you can match the anatomy.